Okay, so this pre-lab is for muscles, but part two. So what we are going to do is we're going to look at muscles of the head and neck and of the torso because we did the other muscles in the previous part one. And then in addition to basically, I'm going to show you the virtual dissection of the muscles because the most of it is just you have to identify the muscles based on the location, and so you can get it from the dissection that I'm going to show you just now, and also from the from your lab manual and the printouts and the models. So it's basically identification of the different muscles in these areas. And then I'm going to also record another pre-lab, but that is going to be for your neuromuscular junction and the muscle physiology. Okay, so let's get started. So we are just going to look at the head and neck muscles. This is in your chapter 14 of your manual. And so let's get into the table 14.1 basically summarizes all the muscles there. So it's very easy, but let's go and do a little bit of dissection. And there we are. Okay, so this is your head and neck. So let's get your anterior view. Okay, so from the front, so let us look at that. So we are just basically dissecting coronally. We are taking off the skin and so on. So you can see that's your frontal muscle, right? Orbicularis oculi, that's the one that is surrounding your eye socket. Levator labii superior, and then your nasalis muscle, levator labii superioris, and then zygomatics, right? Zygomaticus, that's attached to your zygomatic bone there, cheekbone. Orbicularis oris, zygomaticus minor, that's the minor muscle, and that's your major muscle. Buccinator, this is involved in movement of your jaws and your tongue and so on. It is platysma, right? Let's next level of dissection. So what do we see here? Depressor anguli, depressor labii, sternohyoid. This is important. This is going to be attaching your hyoid bone and the sternum, basically. Omohyoid, sternocleidomastoid. This is a very important muscle and it's very prominent, right? That's basically your neck muscle that connects your head towards your sternum, and then your trapezius from behind. You can see that. Okay, so deeper to that, you see the scalene, right? And sternothyroid, and then thyrohyoid. There are three hyoid related muscles, and that's the deepest one there. And when you remove it, you can get your skeleton, right? So let's look at the lateral side, right? So sideways. So what do we see here? That's the sternocleidomastoid, like I said before. So you can actually see that at the side of your neck already, right? Sort of feel it. So let's dissect the first level. So frontalis muscle there, occipitalis. Right? So that's in the back of your head. Orbicularis oculi, as you see, that is around your eye. Nasalis muscle, levator, these are from the previous one. Okay, zygomaticus major. Masseter is another muscle that's involved in mouth movement, right? When you move your jaws, especially when you're eating and stuff. Okay, platysma. So that is like, underneath your throat, sort of that area muscle. Okay, let us dissect that further. And then you see your temporalis attached to your temporal of the skull, temporal bone. Buccinator, orbicularis oris. So basically that's the around your mouth. Depressor labii, depressor anguli. Omohyoid, we saw that earlier. Sternohyoid, right? Then you have in there you see your sternocleidomastoid, splenius capitis, splenius muscle, then your trapezius from the like sort of behind the shoulder toward the back. All right. So levator, these are the, like, when you go interior to your eye, right? Eye socket. So levator palpebrae, and then superior rectus, lateral rectus, inferior rectus, inferior oblique. All of these muscles are involved in movement of your eyes, right? Like your lid movement and then rolling of the eye, all of those things, these are going to be involved in that. Then you have your lateral pterygoid muscle there, right? That is again deeper to your zygomaticus, medial pterygoid, stylohyoid, right? And then mylohyoid, digastric, thyrohyoid, and then your levator scapula. You start to see that levator scapula, which is in, we can see also from the posterior side, because that's going to be attaching from the side of your neck toward your back, right? Scalene, you can see that, sternothyroid, and so. Okay, now what do we see at the last one? Okay, superior oblique, medial rectus. So these are again involved in the movement of the eye. Styloglossus, right? Pharyngeal constrictor. So this is involved in especially when you eat something, right? Movement of your pharynx, and then hyoglossus, genioglossus, like basically, right? All right. Mid sagittal. So now we have cut the body into two, and so we are going into the interior portion and seeing if what kind of muscles we can identify there, right? And so this is soft palate, right? This is the not the muscle. This is not a muscle. Basically, this is the the bone part of the inside of the mouth, right? So roof of the mouth there, palate. Then you can see the, but then you can see the orbicularis oris, that's the muscle around your mouth, genoglossus, then pharyngeal constrictor again, geniohyoid, mylohyoid, and so on. Okay, and finally we have the posterior side. Okay, so from behind. So let us start dissecting there. So that's your occipitalis muscle. So this is your occipital bone, and there's occipitalis muscle, nuchal ligament. This is we talked about it today in the class, right? Nuchal ligament is like basically the ligament, part of the ligament that's holding your head with the neck. Okay? And sternocleidomastoid, as you can see here, trapezius muscle, right, from the shoulder area. Okay. So that is your splenius capitis, then splenius cervicus. So this is splenius attached to the head. That's why it's called capitis. This is cervicis, cervical area, head, neck area. Levator scapula. Already you start to see that levator scapula there. Semispinalis capitis. And then we are dissecting further. So that's your pharyngeal constrictor. So you have taken the backside off now. So you can see what we saw in from the from a forward push position. That is pharyngeal constrictor there, stylopharyngeus muscle. Okay. So those are the for the head and neck. Then what else we have? We looked at platysma and so on. Let's look at muscles of the face, muscles of the head actually. Thorax, abdomen, pelvis, back, blah, 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 blah. Oh, these are all origins. That's fine. Let us see. Muscle attachment. Muscles of the head and muscles of the
and torso. Okay.
So the muscles of the head and muscles of mastication that are put in separate sections in your manual, we already covered under this. Basically, all the pterygoid, orbicularis, oculi, and so on. Zygomaticus major and zygomaticus minor, and then the temporalis, and then your masseter, and so on. And so basically, that is about it for that chapter chapter 14, right? You do not need to know anything about the head and neck of the dissection of cat. So we are going to just move on to chapter 15, which is the muscles of the torso. Okay, so in here we are going to look at we are going to look at the abdomen, right? All right, so let's look at the abdomen area. So we have just done the first layer of dissection. So what do we see here? So that is the linea alba. If you actually go and check your body, you will see that there is a um, sort of like a white line, midline in your body, and that is the linea alba, white line, basically. That's what it means. Anterior rectus sheath, and then you have your external abdominal oblique muscle. You can already see this is in the side portion of your body, right? So, and as you see, it's oblique, so it's like sort of slantingly oriented. Okay, so we dissect that off, and then we see you can start to see the tendinous intersections of the rectus abdominis. So this is rectus abdominis, but then these are the tendons actually. So that is not a muscle, just a tendon. Rectus abdominis. This is rectus abdominis, like I said. So it's actually segmented by these tendons, and then internal abdominal oblique muscle. Okay. So rectus sheath, posterior rectus, then transverse abdominis. So as you can see, the orientation has changed. So that there is no way you can mistake this. So the oblique will be like, slanting, and then this is rectus will be like vertical, right? As you saw earlier, and then so the transverse will be horizontal orientation of the muscle. So that is your transverse abdominis muscle. Okay, so interior to that, you have the quadratus lumborum, right? Interior to that, then you have psoas major. You already start to see the psoas. This is part of your pelvic area, iliacus muscle as well. Okay, then that leaves us with the then that's abdominis. Then let's go to your thorax. No, let's actually go to the pelvis first, right? And then this is a psoas minor. We saw the psoas major earlier, right? And then that's basically psoas major again coming there. Piriformis, right? Iliacus. So this is part of your hip muscle, iliac near the iliac bone. Ischio-coccygeus, right? So that is close to the coccygeal vertebra. Pelvic diaphragm, levator ani, then tendinous after the levator ani. Okay. So if you remove that, then basically you say, oh yeah, that's the pelvis, right? So it makes sense. All right. Then let us look at your thoracic muscles. Yeah. All right. So that is your deltoid, the triangular muscle. Pectoralis major, right? So this is what we call as the pecs, right? The chest area muscle, right? So with a lot of exercise and everything, you can really tone down this muscle, right? And so that is pectoralis major. And latissimus dorsi, right? That is in the sort of the side area. Anterior rectus sheath, and then external abdominal oblique. As you can see, that is oblique angle. Okay, so that is your sternocleidomastoid. As you can see, pectoralis minor, right? So that is interior or deeper to your pectoralis major. Then you have an external intercostal muscle, right? This is going to be the one that is involved, or it's going to be associated with the ribs, right? Rectus abdominis, once again, it's going to be the vertical oriented muscle there. Okay, then you start to see the serratus anterior, and then your internal intercostal. So the external intercostal was superior or superficial to the internal intercostal. Again, this is also holding on to your ribs, and then you get your diaphragm, right? So that's the dome-shaped thing that separates your lung and everything from your stomach area and so on. Okay, let's look at back. Okay. So trapezius muscle, right? So you can see that it's like sort of a trapezoid picture, shape, and so it's called trapezius muscle. Latissimus dorsi, we saw that from anterior side earlier on. Then you have your thoracolumbar fascia. So it's basically muscle bundle there, right? And then okay, now that is your splenius capitis again. That's your levator scapulae. This is the one that's going to be connected to your scapula, and so it helps you move your shoulder, right? So especially when you're shrugging and stuff, right? So it's basically levator, you elevating the shoulder. Rhomboid minor, that's a rhomboid minor, and rhomboid major. So that is like basically rhomboid shape. You can see that. That's your serratus posterior superior, right? So it's like basically beautifully arranged like that. And then you have serratus posterior inferior. That's your semispinalis capitis. Then you have your spinalis part of the erector spinae, and then longissimus part of the erector spinae, and like that. So these are all erector spinae are the ones that are going to be holding up your spinal, spine, basically your vertebral column and everything. And so they're going to be much deeper than your trapezius and the rhomboid and everything. So but then interior to those muscles, these are going to be holding up your posture, right? These are basically your posture muscles. The erector spinae, spinalis, longissimus, and iliocostalis, all of these are your postural muscles. Then you have your diaphragm, splenius. We looked at splenius. Okay. What else? Then we can, yeah, that's basically back. And then we did shoulder and arm, forearm and hand. These are all we did finished in the previous one. Okay. So I'm just going to give you an example of the origin and insertion of muscles. So we talked about it, I think, earlier on, right, where a muscle actually starts at some place, but then it attaches to some another muscle or a bone. Another bone, and in a different area, and therefore, you have a movement like that, right? So a lot of times it's important to know the origin and the insertion of a muscle, right? And so some of the examples are given here. So this one is like, for example, your thoracic cage, right? And so let's look at that. So origin of sternocleidomastoid, right? Insertion of middle scalene. So you can see the origin of subclavius, origin of pectoralis minor. That's your pectoralis major, right? So that is where it starts, and then it will go and attach to something else, right? And then you have the insertion of external intercostal, origin of external intercostal. So that's, you can start there, and then you insert there, right? Or basically in the other side as well. Serratus anterior, insertion of lateral arcuate ligament insertion of quadratus lumborum, like that. So this is the area where the quadratus lumborum will actually end up, like, so that's why it's called the insertion. Okay, so vertebral column, for example. So that is the levator scapula. That's where the levator scapula will come out like that, right? And then origin of splenius capitis, origin of rhomboid manus. So this is basically the bone, I agree. But you see the red spots there? Those depict the origin, okay? The blue spots, if there are any, will be the insertion areas. Okay, so basically that the muscle will attach from here to wherever the insertion is, like that, right? And so you have your origin of splenius capitis, rhomboid minor, insertion of, here it's an insertion of spinalis, and so on and so forth. So you will have the very distinct way the muscle starts and where it actually attaches to the other bone. Okay. Yeah, so that is fine. And then I think we finished all of that. It's head and neck. And yeah, splenius sternum yeah. So what I'm going to do now is I'm going to end this recording, and then I'm going to make a second recording for your muscle physiology. Okay.